Here, I think is going to be really exciting for our viewers this morning. The first oral pill for obstructive sleep apnea could be just around the corner. Dr. Reena Mehta with Uptown Allergy and Asthma joins us to discuss what this could mean for the millions of people who struggle with sleep apnea, who don't want to be diagnosed with it, and who have to sleep with those masks. Well, we'll get into it all in a second. Dr. Mehta, good morning. Thank you for being with us.
Thank you for having me.
So let's first rewind. For people who don't know what sleep apnea is, and they may even have it, what is sleep apnea exactly?
So obstructive sleep apnea is exactly what it sounds like. When you are sleeping at night, your upper airway muscles become obstructed. They collapse on top of each other, which means it's hard to breathe at night. And so then what ends up happening is you're gasping for air. When you're gasping for air, then your oxygen saturation can get lower. And so you're almost like drowning, you can't breathe, and then suddenly you come back up. And then if that happens many, many times at night, then you feel terrible the next day. You're tired, and it has an increased risk for things like heart disease, high cholesterol, high blood pressure, stroke, things like that.
And is sleep apnea always associated with snoring, or is it just often associated with snoring?
It's usually associated with snoring. That's usually like the first sign of something of that sort. And usually it's related to weight. You know, people who are overweight tend to have it more because, again, there's just that much extra fat around the muscles, so then the muscles tend to collapse.
So how has sleep apnea over the years, how had it been being diagnosed?
So usually with sleep studies, which would show whether you have sleep apnea or not and whether there is decreases in your oxygen saturation. And then, you know, up until now, treatment has been, you know, those really annoying CPAP machines. With people who use CPAP machines understand that it's sometimes frustrating to put it on, to wear it, to clean it, to store it, to travel with it.
They've changed them over the years to make them more comfortable, convenient for people, but they're still pretty big and annoying for a lot of people to try to sleep
it's still a thing, exactly. And then, you know, we do have the product Zepbound, which is an injection for obstructive sleep apnea, especially in patients who are overweight. But this, what we're talking about, is the first oral pill for sleep apnea.
So what did the study show about this pill? What were was it successful? Was it effective?
Yeah, so this was a phase 3 clinical trial, the actually second phase 3 trial. So we've got a fair amount of data on this drug. It's called AD109.
Okay.
And basically, it's a once-a-day pill that you take for obstructive sleep apnea. And the way that it works is that it sends a signal to the brain to tighten up those upper airway muscles. So in response to sleep, instead of collapsing, they tighten up so that then you're not having the obstruction that happens. Very effective.
I was going to say, this is a game changer for people who are used to having to lug these machines around if they're traveling or just at home every single night. They could potentially just have to take a pill.
Exactly.
And it will do what this massive machine has been doing for however long they've been using it.
And the study showed in over 600 patients, 50% had significant improvement at the end of the 26-week study, and 23% of patients said they were in complete remission of their obstructive sleep apnea.
That is incredible. Yeah. Dr. Mehta, the last question I have for you, I'm sure, is what people at home want to know most of everything we said. When could this potentially be available for people to purchase and start using?
So the hope is that we will get FDA approval in early 2026, so around the corner, and very safe. They really found that the safety profile was great. And so that's the good news, because patients also want to know, like, is it safe? You know, are there any warnings? And really nothing major that we saw. So effective, safe, around the corner in 2026.
This is so cool. I guess we should probably repeat the name of the drug just one more time in case people want to go look up and more information on this.
It's called AD109 by the company Apnea.
All right, Dr. Mehta, thank you so much for your time and this really probably awesome news for a lot of people out there who are watching who have been suffering or don't want to be diagnosed with sleep apnea because they don't want to have to deal with the repercussions of that. We appreciate your time this morning.
Thank you so much for having me.